Kim is a typical patient I would probably see in my office. 40-something, kind of beginning to show some definite signs of aging, and is a typical patient that we could do a lot with using botulinum toxin as well as fillers. What I typically like to do is divide the face to the upper third, the mid third, and the lower third of the face. So if we start with her forehead, in general what happens in a middle to late 40s is that we see a narrowing of the forehead happening. You know, a youthful face typically has a wide forehead, and with age we see it narrowing, and the base of the face, the lower third, typically tends to widen. So we have what we call a inverted triangle, where we start to see almost a pyramidal face where the base widens and the forehead starts to narrow. Kim, could you actually frown for me? Now, this is a typical area. Obviously, most patients will come in even in their 20s that complain about a deep line forming. And it's a typical area that's actually treated very well and very successfully with botulinum toxin. And if we just relax that muscle, she would get a nice open look to her forehead. If she continues to have a deep crease even after botulinum toxin, sometimes we will go in and put a little filler in those creases, which will further relax it and give her a little lift. Kim, could you raise your brow up like you're looking at the ceiling? Now, we do see some wrinkling on the forehead. Typically, I don't like to do too much Botox up here because that's one area where you can actually cause a drop in your forehead. But we can certainly soften those, but we also have to raise the lateral brow to make sure her eyes stay open. And on the lateral part of her orbit right here, we see typically a lot of fat loss, bone loss, and it becomes a concavity, and it shadows. Anywhere we shadow informs us that it is an area where we can put filler in and change that concavity to a more convex angle where light therefore doesn't shadow but bounces off. Probably where we see most of what I'm going to probably treat on her is in her mid-face. Typically we have 3 fat pads underneath the mid-face, the deep medial, median, the lateral fat pads, which start descending and starts to pull on her orbital region, making her look like she has very tired eyes. If I put my Q-tip right here, we can see that in her mid-face she is losing fat, and the fat is descending and abutting on her mouth region. And also she has a deep canine fossa, another good area to lift. You can see that if I just lift her lip up and put a little bit of filler there, it completely changes her angle and makes for a soft fold here. In the olden days, we used to typically go and fill this fold, but as we've learned more about the anatomy of aging, what happens is you put too much filler in here and it caused more weight actually around the mouth area. So what we really now do is try to pull from behind here, put filler back here in the mid-face where we really have most of the fat loss, and pull that fold back, and that will really soften the nasolabial fold. If we look at her angle of the jaw, on a young face, we will see a kind of a clean line, which actually on Kim is not too bad at all. Another typical area is the preauricular area, where we start to see some wrinkling, and that is a sure sign that we are losing fat. And it's a typical area that we want to go and put filler and pull that skin back, and that will improve her jawline as well. One other area I wanted to talk about is the chin. It tends to recede and create this deep crease, and we can fill this little crease, but we can also put some botulinum toxin here to relax that chin, which will really soften that whole area. We also see that she is starting to have a kind of a downturn to her mouth. If we go and put the Q-tip here and press on it, we know that there is definitely bone loss, fat loss, and muscle loss down here, and the mandibular area typically is an area that as females we will lose a lot of bone. If we kind of do that, your skin will show you where you've lost tissue, and that will be a typical area we would fill. If we just pick that corner of the mouth out, it really changes our whole look to somebody who looks sad and not so happy and grumpy to somebody maybe a little happier.